Hi everyone, my name is Dr. Umair Khan and today we'll be talking about Lyme disease. Now imagine you are traveling in the beautiful forests of Connecticut and you're exploring and admiring the beauty all around you. Now suddenly you feel something on your arm and it stings, but as you don't see anything, so you just continue on your merry way. Now after 1 week or so, the area where you felt that something had bitten you before starts getting a bit red. It turns into a circular rash and looks like a bullseye. Now if that happens to you, know that you might be suffering from a disease known as Lyme disease. And the rash which now appears on your forearm can be called a bullseye rash, which is basically pathognomonic of this disease. Now what is Lyme disease? Lyme disease is the most commonly transmitted tick-borne infection in the US and among the most frequently diagnosed tick-borne infections worldwide. Now, Lyme disease was first described in 1977 as Lyme arthritis in studies of a cluster in Connecticut of children who were thought to have juvenile rheumatoid arthritis, that is GRA. Now, the multisystem nature of this infection became clear as involvement of other systems was subsequently identified. Lyme disease has been divided into 3 stages: an early localized, early disseminated, and late. Now we will be talking in detail about these 3 stages as these are extremely high yield. Furthermore, the diagnosis is not always easy as many patients are not able to recall a tick bite. However, in endemic areas, patients who have the typical rash can be started on treatment right away without waiting for serology. Now this last point is extremely high yield as most physicians start treatment of Lyme disease if the index of suspicion is high. So try to remember that. Now let's talk about its etiology. In the United States, Lyme disease is caused by the bacterial spirochete Borrelia burgdorferi and is transmitted by the bite of an Ixodes genus tick, most commonly Ixodes scapularis. Now I know these are difficult terms, but just try to bear with me here. Now in Eurasia, the prominent causes are Borrelia burgdorferi, Borrelia fzlii, and Borrelia guerini. Again, these are extremely difficult terms, but it has to be told. Now, Borrelia burgdorferi is 8 to 30 microns in length and about 0.2 microns in width. Now, just to emphasize the important thing here, you have to remember that the bite of Ixodes tick transmits Borrelia burgdorferi, which ultimately is the cause of Lyme disease. This one sentence will be heavily tested during your medical school, so try to remember it. Now let's talk a bit about its epidemiology. Lyme disease is most commonly reported in the northeastern and the upper midwestern US states. Now the primary states with endemic Lyme disease are Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, Virginia, and Wisconsin. Now these are a lot of states to remember, so if you want to just keep it simple, try to remember that most of these states are in the east coast of US. Now, sporadic cases have been reported in Northern California, Oregon, and Washington. Now, it's important to remember that in states where Lyme disease is common, the incidence is about 40 per 100,000 people. And the infection occurs during late spring, summer, and early fall. Now, for some unknown reason, Lyme is commonly reported in Caucasians, but it can affect all races. Perhaps the skin lesion may not always be obvious in dark-skinned individuals. One more important point to remember is that Lyme disease affects people of all ages, but it appears to be slightly more common in females. So guys, this brings us to an end of our first section, in which we briefly talked about Lyme disease, we talked about its etiology, we talked about its epidemiology, which is high yield from an exam point of view. So after this, we'll be talking about its pathophysiology, about the clinical features of Lyme disease, and how to manage a patient with Lyme disease, which are all high yield. So stay tuned to sqadia.com to learn more about Lyme disease. Thank you.